Assalamu alaikum, I'm Dr. Tahira and you're watching PTV World program Health is Wealth. Cancer is a word that we all dread. We do not want to listen to the word cancer and we fear it more than our lives. But we don't need to fear it because there are a lot of treatment options now available and timely detection saves lives. Today we meet oncologist Dr. Wajid with us, who will be talking about all that you need to know about cancer, its diagnosis and its treatment. Assalamu alaikum, Dr. Abdul Wajid is with us, oncologist. Sir, let us start with this. Why is cancer so scary? The moment we hear the word cancer, everybody is terrified and they think now it's just, the death awaits us, and then they get all depressed and gloomy and the whole family starts mourning right in the beginning and they just give it up. So could you please explain it out? Why is cancer so scary, or is there a way out and they don't need to be terrified of this really ghost word out there?
Assalamu alaikum. Thank you so much for having this talk and wonderful topic, and I think it's a very important topic that we're talking about. And you're right, absolutely. Like, cancer is a word where when we hear it, it's just a very like a big bomb falls on the family and the patient and everybody. And a lot of times patients just don't want to talk about it, don't want to mention this word because it's such a scary thing. And I think the reason why that is because of the high lethal, reason for it, because there's a very high death rate, mortality rate, and traditionally we've been talking about we don't have enough cure, enough medicines for it, and very high mortalities. Now things are changing, but this
the fear remains. So previously it used to be very, very fatal. So what you're trying to say now is it's a good news for us that cancer is not as fatal, or maybe its early detection is what is the real thing, right? The real bottom line. So we see all these ribbons out there, we have pink ribbon in October coming up and everybody's talking about breast cancer at that time. But there are so many other cancers as well that are equally prevalent and even more dangerous. So first and foremost, could you tell us the symptoms of cancer? For example, if somebody sees any of these symptoms, what should they, it's a red flag for them.
Absolutely. So one of the very important symptoms that we see in patients is that they start losing weight unintentionally.
Okay.
There can be lumps and bumps anywhere, like lymph nodes here or in the axilla or somewhere. Then we do see people who have bleeding from the urine or from the stool, especially older, like mid-50s, 60s, when they're not supposed to, women when they're postmenopausal, or men at any age. And once those are symptoms that are there, then a fever that is not improving, weight loss, just lack of appetite, which is not normal and it's just prolonged. Let's say somebody has lack of appetite for a few days because of flu or something, that's fine. But if it kind of persists, that's a red flag for us. We need to kind of investigate it further.
So if somebody has rapid weight loss and they lose their appetite, and you said there is bleeding from any part of the body, and one more thing that you mentioned was, there's another thing, I think, change in bowel habits. So they start having alternating diarrhea and constipation. And if they have any lesion on their body which starts to change in shapes or size or whatever, right? So what should they do? What should the first step be of somebody who detects that there is a lump, there is a bump, there is a mole that has increased in size, is bleeding now, or has changed its texture?
So the first thing we recommend is that if there is any suspicion that you may think that it could be something which is out of the ordinary, I would recommend you to go to the nearest doctor that you have and ask them about it. Ask them if this could be any symptoms of cancer as well. Because a lot of general practitioners as well, they don't look at it for the first time. They usually focus on other things as well, like infections and other things. But they also need to you have to ask that question: is that something you feel in your mind? Something that, like, if your friend or family members, anybody else had cancer, and they would want, you would be at a higher risk, so you would want that lump to be checked out first. I'll give you an example. Young ladies who develop little lumps in their breast. So that could be benign as well, but it could be malignant as well. So if they have a family history, if their mother or somebody else had cancer, so they were more likely to, it could be malignant. So that lump should not be ignored. That needs to be properly checked by a qualified surgeon or a female doctor or anybody.
You know, after the examination, there's a lot of talk about self-examination. We'll go to breast cancer in detail later. But other than examination, what are the diagnostic procedures? For example, how important are these tumor markers, and do they actually tell us about something or not? Because not everybody can go for a mammogram or a biopsy and so on and so forth.
So a simple blood tests are not very helpful. Tumor
Neither
markers,
tumor markers also?
yes, so they're kind of non-specific. Sometimes they do get raised, sometimes they, even with the tumor present, they do not get raised. So we don't want to kind of depend on it, oh, that's normal, I would not have cancer, so they would just let it go.
Right.
So we would recommend that we go with standardized tests. After examination, usually we recommend that if it's, we get a CT scan or X-ray or a mammogram, or if it's talking about colon, get colonoscopy done, a definitive test as well as a biopsy. So it all depends what kind of risks are there. If it's very, if we're looking very dangerous, if it looks, oh, it could be malignant, we would want to go for a biopsy as soon as possible. And because that's the only test that kind of tells us, from black and white if it's cancer or not.
So why do people fear biopsy? They have this fear that, if we are going to touch the cancer, it's going to spread. So we'll not go for a biopsy because, God forbid, if they are going to, take out the piece and examine it, then it's going to spread everywhere. Is that true in any way, or is it a myth?
So it's a myth. Overall, it's a myth. But it's for very rare cancers. We know that if we biopsy it, there's a chance of spreading. So only in those cancers, like the testicular or liver and renal, these are only 2 or 3 cancers that we have to kind of, when we biopsy, we go through a certain way to go in a biopsy. We don't we don't go through the skin. We have to go in a way that we don't spread the cells that are coming out.
So this is a very important point, because a lot of people out there who are running these diagnostic labs just for the sake of commercial reasons, they're willing to do biopsies. But it should be done by an oncologist then, right? So could you stress this part specially, because people go around, they get these biopsies done and then they come complaining. So it should be done under the supervision of a licensed oncologist.
Exactly. I think that's a very important point. I think because cancer treatment, initial diagnosis and treatment is very specialized, and people can get misled very, very easily. I mean, in today's world, there are a lot of inexperienced people who kind of try to, go in a direction where it can benefit them, but it can harm the patient a lot. So being as patients, we have to be self-aware, protect our own interests. We have to go to a very qualified person who deals with that. So they can tell you how and what test needs to be done first, and how they can be, that will help you get diagnosis early, get treatment properly treated, and not waste money as well, doing irrelevant tests and irrelevant medications as well.
And then an oncologist is required to actually stage or grade this cancer once the pathology report is here. So could you actually explain it out to people, what grading means, what staging means, and which stage are they comfortable with and they shouldn't fear?
Absolutely.
Yeah.
So grading and staging are 2 different things. When we talk about any cancer, we want to know how much is spread. Has it spread to just the local area, has it spread to other parts of the body as well? So that defines our treatment. Is that, can we cure it or can we not cure it and control it only? So for that we need the CT scans or a PET scan to kind of define so that defines the stage of it. If it's localized, we say it's a localized stage 1, 2 or 3. If it's spread throughout the body or other places, we say stage 4. That means it's metastatic and it may not be cured that easily. But things are now blurring in lines, because even if it's stage 4 cancers, there are new treatments that are coming up, and that can even potentially cure patients as well. And grading, on the other hand, again, it's a histological diagnosis. When histopath, like the pathologist, kind of sees it under the microscope, they can then tell us how aggressive the tumor is. So it goes into grade 1, 2 and 3 and tells us if it's fast growing or slow growing.
So, they say that it's because of some kind of oncogene, and that there's some kind of mutation, and that there are a lot of carcinogens out there. So what exactly is it that sets this, uncontrolled mitosis of cells, and then a tumor develops and then it starts eating all the nutrition of the body? What triggers it? What is the one point? Is it family history? Is it genetics? Is it all these, the radiation we get outside, our diet? What would you say?
So it's a multitude of factors. So for minority of the patient, maybe 10% of the patients, it's linked with family. Family, when there's you know, their genetics, their mother or father would carry that gene, and that would come on to the children as well. So we do see that in some cancers as well, you know, colon cancer as well, prostate to some extent, breast cancer is somewhere in ovarian. So these are some of them which can run into families as well. And they have abnormal genetics which can carry on. But I think 90% of the patients, they have developed abnormal problems during their lifetime themselves. They don't carry on. And that's underlying because of radiation, stress, our eating habits.
Stress does play a role in actually causing cancer?
I think it does overall deteriorate your health a lot. Okay. And once it puts a lot of stress in your body as well, so a lot of hormones get released like cortisone as well as, so a lot of those things can overdrive the body.
So a persistent state of staying in stress can actually ignite this entire cascade of developing cancer. So, and what are these carcinogens? For example, is microwave a carcinogen, unwanted exposure to X-rays, staying out in the sun without sunscreen protection? Are these all carcinogens?
Absolutely. So these have been proven in multiple studies as well. So staying out in the sun, going through close to a radiation kind of facility where there could be radiation, you know. So those are known carcinogens. Even with Hiroshima and previously, there were in those areas there were high levels of leukemias and lymphomas. And so when we work with people who work with, like, let's say X-ray machines or CT scans, so they have to wear protective suits as well, just to make sure their body does not get exposed to it. So in daily life, we have to be very careful about these things.
And what about these, you know, a lot of doctors nowadays, they just keep prescribing MRIs and CTs and X-rays repeatedly. So should we be avoiding this as well? Please stress on this point, because people don't realize how dangerous this can get.
Exactly. So CT scans have a very high radiation rate. That's a very, very high, like equivalent to like 1,000 X-rays. So that's a lot, very high radiation. So a lot of times we, even patients come to us and they say, oh, can we get a CT scan? We have a little pain over here. We've heard that that's a test that needs to be done. But we have to kind of explain to them very, very clearly that it's something that's not needed. So for these scans which have high radiation and, you know, costs and everything else, there are set guidelines throughout the world, US, UK, you know, European, Pakistan, everywhere there are set guidelines that we have to follow. When we have to get a CT scan, when will that be beneficial? So only reason when that's done is that the risk and benefit is, you know, we have to weigh that. If the benefit is more and the risk is less, then we go ahead with that.
What about the things in the diet, all these dyes and emulsifiers and colors and additives, preservatives, how much of a cancer do they cause?
So again, those are chemicals, those are altered chemicals, those are not natural, not, you know, it's not in nature's way of
it's not organic.
Yeah, it's not organic. And those are all chemicals, and those chemicals are very hard for our body to digest and kind of take care of it. And those cause stress to the body as well. Anything those cause stress then can be directly linked to cancer as well. So in our daily life, I think that's what's changed in the past maybe 50 years or something, where our grandparents did not have exposure to as many
packaged foods,
artificial
processed
things.
and packaged.
And now our daily life cannot go without that. We have to rely on them so many times, like microwaving, everything.
And these plastic bottles that we use.
Everything. You know, all of those things, as well as, you know, just preserving everything. So those things have abnormal, you know, carcinogens, isn't it? We have to be very careful, try to go with organic diets, especially with our children as well, to kind of ensure that we don't, you know, go on buying everything that they put their hands on.
Dr. Saab, you mentioned the diet and importance of having an organic diet that is not processed, not refined, and not packaged. What about things that people are applying on themselves? Because nowadays influencers are out there telling people to apply every single serum available in the market. So can you stress on how it is very dangerous to apply just anything and everything repeatedly on your skin as well?
Exactly. So a lot of these products have not been tested for, you know, how dangerous they can be, and they are not, you know, they've not been FDA approved or, you know, from regulatory authority as well. So they have to go. We don't know the long-term aspects of it. Just like smoking in one, you know, in 60s, 70s was considered to be very good, fashionable. Everyone used to do it. And then we, in 10, 20 years later, we found out that it's such a big carcinogen. It's, you know, causes lung cancer. It's a very high rate of lung cancer in those patients, on those people who smoked. So just like that, we don't know how much dangerous these things are. So we have to be very, very careful. The less we use them, the more natural products that we use, is much, much better, I guess.
So Dr. Saab, you said that cancer is not as scary anymore any longer because it is curable. and that is why people need to come for early diagnosis. So let's go with the most prevalent cancer in males first, that you mentioned is lung cancer,
Yes.
considering the pollution and the cigarette smoking and everything. What are the symptoms of lung cancer, number one, and at what stage can it be cured?
So lung cancer, so one of the, I'll talk about from start.
Yeah.
So one of the major causative factors of lung cancer is smoking and smoke in the general environment as well. So those causes damage to the lungs and then can cause cancer. And long-term smoking, like people who've been heavy smokers for a long time is the one who are
Right.
really at risk. So what people come up with symptoms is that they start losing weight, unintentional weight loss, cough,
Okay.
sputum production, and then
Blood
sometimes
as
blood
well.
in the sputum as well.
Right.
And then they sometimes develop chest pain, short breathing difficulties. Those things are coming like late symptoms as well. For lung cancer, it's kind of very difficult to kind of detect it early because it's sometimes inside, and by the time we can have these symptoms, things are usually a bit late. So we usually recommend that we should be more focused about preventing it, and rather than going for detecting it later.
But do you have like options for chemotherapy, that those are the treatment medications, or radiation or surgery for lung cancer?
Exactly. So for lung cancer, treatment has changed over the past 5-10 years dramatically. Previously, with metastatic lung cancer, people did not have a very long time to live. We were talking about months, not in years. Now we're talking about years and decades. Because there are newer targeted drugs have come up with newer genetic mutations. We test for people, like I've seen just younger people who come in with lung cancer. We detect genetic markers in them, and then we have targeted treatments. So every person would have a different kind of treatment based on their genetic mutations. Now, so these are the little things that they improve the outcomes of patients dramatically now.
People don't have to give up, because people get scared and they give up and they're terrified and they hide it from the family and they just don't want to go for treatment. But if they do get into treatment, there is hope and there is light at the end of the tunnel.
Exactly.
Now the next thing, the most prevalent in males, another one, especially older males, is the prostate one. So what are the conditions under which you can actually diagnose that, oh, okay, his urine hesitation might be because of prostate, and does PSA help, and what are the treatment options?
Exactly. So prostate cancer is more linked to age as well. So we don't see that in younger people. We see that in older people, like above 60, 70, and 80s. And so people usually start off with having difficulty passing urine, and painful, pain when passing urine as well.
Yeah.
And then they also develop back pain as well. So prostate cancer usually goes with the backbone as well. It's a very common site for it. But it's a very highly treatable cancer. It's a very highly, we can manage it very, very well. For we're talking about, treatment with decades in it. PSA is a very good test for it. We do that as a screening test as well. We do ultrasound simple test as well, and we can detect that. And then for that as well, there are new treatments as well, and that that's also kind of very well manageable as well.
So there is resection and all of that is
exactly.
possible. Now coming to the very famous breast cancer, very notorious actually, we should say it, and we speak a lot about its awareness. The only reason being if you can save somebody's life, and that is why we've chosen to speak about this cancer and not other cancers as much. So could you please tell people all about the symptoms, even though they do know a lot about it, but still the symptoms and the ability to get rid of it as soon as possible.
Exactly. So breast cancer is kind of becoming an epidemic now. I think almost half of the patients that we see in our clinics is now are breast cancer patients now. For women that
What do you think is the reason for such high incidence?
I think it's because of the rapidly changing diet and stress
hormones and
all of those things that we're changing. So women are exposed to hormones a lot more now. Then a lot of stress in our lives as well, from everyday things, and those are things that are there. Also, I think there's one aspect which we kind of tend to overlook is that we detect it more now. Maybe in previous years we did not detect it as much, and we just
And could it be a cause that we're taking a lot of contraceptives, and also there's a lot of hormonal intervention in terms of other things, and not breastfeeding? Does that play a role?
Exactly. Yeah. So traditionally, women used to breastfeed a lot. Every child, and they used to have multiple children as well, and they would be breastfeeding for maybe a decade or something like that. Now, women having, children later on in their lives as well, so less breastfeeding. and then more reliant on artificial kind of baby feeds as well. So those are protective factors. Breastfeeding is a very big protective factor for breast cancer. So we do encourage women to kind of make sure that they breastfeed their children as much as they can, maybe up to a year or something, and that is very it's one protective factor as well. Then again, like you said, hormone tablets that they take, like oral contraceptive pills, those can also be as a risk for breast cancer as well. So we do recommend that we should avoid those. Then there are generally things like just artificial foods. They have a lot of steroids in it as well.
Especially the chicken and the milk that we are getting lately.
So those things can aggravate these cancers as well. So generally for breast cancer, one of the biggest things challenges that we feel in our society, especially in Pakistan, is that women don't tend to come forward for it. They're more shy. They don't want to talk about it, even with their immediate family members. So I would, really recommend and urge women to kind of come forward, even if they have smaller lumps, and come forward, talk to any. There are a lot of female doctors, even in smaller cities and villages as well. They can go to the healthcare workers they see, or any nurse that they know, and so they can go and get examined, and then if they think that's something that needs to be checked out, they can come in and get a biopsy or something like that.
So if there is a difference in size and the nipple is inverted, or the appearance is like of an apple or orange peel and all of that, there's discharge or change in texture, or there is a lump of any sort, that's when they go to the doctor and the doctor sees them. How about these regular screenings that are advised in many parts of the world, like they should be going for a mammogram after this age? How frequently should they be going for that? Is that unnecessary radiation or not?
I think that's a very important question, and they set guidelines now. So above the age of 50, and some people recommend above the age of 45, all women should get a mammogram once in 3 years. And people or women who have family history, like their mothers or grandmother had cancer, they would start 10 years before when they were diagnosed. If they were diagnosed at the age of 50, they should start getting mammograms at the age of 40, and they would get it a bit more frequently, maybe a couple of years or maybe every year, depending. So those are things that we do recommend. That's been known to save lives. So they can detect very small, tiny amounts of cancer in it, and they can get treated very early. And early treatment can even save lives as well, but also can save you the agony of going through chemotherapy and other things as well.
And what about mastectomy? When somebody goes for a mastectomy, whether it is partial or it's radical with the whole thing, people used to feel scared that there is nothing that could, help them, like a prosthesis or something. But now we have a lot of options where you have that. Could you explain it to them that there's nothing disfiguring about it, and they can continue on with their daily lives, and there are a lot of options in terms of implants and everything else?
Exactly. So it is a big psychological factor for women as well. So when they remove it, they can feel very depressed as well. So now these things have changed. We have a lot of breast reconstructive methods with implants as well. There are now trained surgeons who can get your natural fat from your tummy as well up to the breast as well, and they can look at exactly normal as it was, and they can have nipple sparing surgeries as well. So there are a lot of options now for.
So they shouldn't be scared of it.
They should not be scared. They should, if they have a good consultation done, they can have that reconstruction almost immediately as well.
What about colorectal cancer, another very infamous cancer? How does that present because of our dietary habits? We have so much of spices and irritants and all of that. So what are the role? What is the? They say it's very high in Japan. Is it as high in Pakistan as well or not?
So I think it's quite a high. We see that those patients quite a lot, and it's definitely linked to our diet as well, because we do focus a lot on barbecue as well. So that's kind of charred meat now, and that's very common in our northern areas as well. That's a predominantly meat-based diet, and it's not a very balanced diet. So the body needs a lot of balanced diet as well. So a lot of fiber as well. And carbs as well as vegetables as well. So all of those things helps the gut make healthy. And then there's a lot of smoking and cigar use. All of those things can help damage that gut lining as well. And a lot of medications that we use now. We use medication all the time, like
we pop a pill for almost that.
Exactly, for gastritis a little bit we start popping pills, and for little pain we start having pills as well. So those medicines can also damage your intestines as well, and they can inadvertently cause cancer in some patients as well. So I think it's very important that we keep a healthy diet from that point of view. And if somebody has, if we're talking about cancer of the gut, if anybody has bleeding from the gut, like
so it's going to be dark stools, like very black, black
yes,
stools,
black stools,
iftaris.
or even if they have fresh blood that keeps
Okay.
on coming,
Okay.
or if they vomit and there's blood in it,
Alright.
so they need to kind of get it checked immediately. And
Okay.
so the first test that we usually do is the colonoscopy. We have a little camera, it's done very easily, and we can then look at if there's any cancer, we can biopsy it and we get treated as well.
But it takes time for somebody to detect blood in their feces. So how do they go about it? Like bloating or stomach pain or what? Indigestion, change in bowel habit, what else?
So weight loss is something that we
Nausea as
see,
well.
and some people, men, if they start losing blood, if they start, they may not be able to see blood, but when they feel tired and they check their blood levels and the hemoglobin is a bit
It's
low.
low,
So
okay.
for men it's not normal, so they need to get checked immediately.
Okay.
Then if they're having weight loss, they not want to eat food, and that's abnormal for if they're having months of that. That means there's something that in their gut that's causing them to lose their appetite. So they need to get that
So
checked
what
up
about these
ASAP.
keto diets that are in fashion? What would you suggest? Like people, would you tell them not to follow such fad diets?
So extreme dieting is, I would not recommend.
Yeah.
It's very, very stressful for the body.
Right.
The body changes rapidly, and you can see those people go through a lot of difficulties. And then when they leave it, they start gaining weight as well.
Exactly.
So it's not a natural thing. I would recommend that people go slow and steady. Go with just less portions. Eat a balanced diet, less portions, exercise. And those are things that can help you a lot. Exercise can do wonders. It helps you reduce weight. It helps you reduce with your stress
Right.
levels.
And even helps with cancers. Right?
Cancers, helps you reduce your blood pressure, heart disease, all of those things. So exercise is something that would be really recommended. If you
So
should
is
want to.
stomach cancer, the symptoms are very similar to this colon cancer or not? Or does stomach cancer present any differently? And especially, I would like you to mention the ones in Karachi, for example. Our population over there uses a lot of this betel nut, pan, supari, and all of this. So how does that, and naswar in the KPK regions, how does this affect oral cancer? If you could.
So stomach cancers have a slight different tendency. They tend to bleed a bit more, and they cause blood in the vomit as well. And people, it is just a bit more aggressive as well.
All right.
And unfortunately, we've been seeing younger patients coming as well.
Okay.
So that's linked to more about barbecued meat that can cause that.
Okay.
So we should be a bit more careful about overcooked kind of charred kind of meat as well. Secondly, like you said about betel nut chewing as well as pan chewing or naswar use, that's a big no. In KPK, naswar is a very common thing. In Sindh and Karachi, betel nut chewed and pan is a very, very common thing. And in those areas, we have a very, very high risk and patients with oral cancers.
Yeah.
People come with oral cancers a lot, and those are difficult to treat. And so it's just something that's been very, highly linked to cancer. So it's something that should
And
be
it's a
avoided.
difficult cancer to treat?
It's a very difficult cancer to treat. The oral cancers are very, very difficult cancers to treat because they're disfiguring as well. The major surgeries are needed.
Okay.
So that is something that can be easily prevented if we stop using those things, and they can go towards alternate means of if they have a caffeine kind of or nicotine addiction, they can use something else as well.
Okay, so Dr. Saab, there's another very important thing that keeps coming to us, a very common symptom, especially to a dermatologist, is of itching, generalized itching. And what people do is they keep prescribing steroid creams and spoil them even more, whereas it's suggestive of a lymphoma. So could you in detail explain lymphoma and tell them that it is the lesser of the evils and how it can be cured, and that it does present as itching?
Exactly. So lymphomas can present in various ways. They can present with lumps or little in your neck or your axillary region or your groin region, and they can present with weight loss, fever as well.
Okay. Low-grade fever,
long term. Then people have weight loss as well, and sometimes have night sweats. When they wake up, they're like all sweaty, which is not like natural for anything else. But on the other hand, they can also present with skin symptoms as well. Sometimes they can have abnormal skin lesions or itching, which is not going away with normal, creams or normal kind of medications. So those need to be checked up for lymphoma as well. And for the good thing about lymphoma is it's highly curable. Even with stage 4 disease, which is kind of spread throughout the body, it can be cured.
Okay.
There's a good chance of cure. People do respond very well to it. All ages can respond very well. Like, let's say with other cancers, older people have difficulty tolerating chemotherapy and treatment, and they have poor prognosis. But with lymphoma, even older age people can get cured with stage 4 disease as well. And we have multiple people who have been treated, and younger, it can occur in any age, from little childhood.
And what is the difference between the Hodgkin's, non-Hodgkin's? Is there does it affect the prognosis in any way?
So Hodgkin's lymphoma is one type of lymphoma, and it's prevalent in younger children as well, and in younger adults. And it's a very, very highly curable, a very, very highly easily curable disease. Non-Hodgkin lymphoma is more prevalent in the older people.
Right.
It's a bit less, it's difficult,
less responsive to the chemotherapy.
treatment as well. But overall, both are good responsive cancers that, once we see something like that, we're kind of more relieved that it can be cured as compared to, let's say, it was something else.
And what about blood cancers or leukemia? How do they present, and is it prevalent in the younger population as well? And is there a cure for it? Does transfusion long-term help them survive or improve their quality of life? Is there any permanent treatment for this?
So leukemias are difficult to treat. They can present at any age, from less than a year old children to older 70, 80 years old people as well. And for younger children, it's a highly curative rate. 80%, 90% children get cured from it. But older, it's very, very difficult. Unfortunately, we've not been able to kind of come up with good solutions for it. There are newer treatments that are coming up. They are somewhat effective as well, but sometimes they're so expensive. They're so expensive that it's kind of very, very difficult to kind of be available for everyone. And leukemias in older people is very, very highly, it's high mortality, high fatal. I think 90% more cases don't survive. So it's difficult.
So is there a way to prevent this leukemia?
I think leukemia is linked to carcinogens in our diet as well, especially artificial things.
Sweeteners, do artificial sweeteners play a role?
Sweeteners as well as preservatives in our food. Then radiation exposure, like, if you're living near a plant that may be emitting radiation, or people who are working in a place where there's high radiation as well. So we have to be careful in our environment as well, so we don't, we don't spend too much time if it's something like outside where there's a lot of sun as well.
Right.
So we have to be careful in those aspects.
So in Pakistan, there's a very high incidence of hepatitis C, and people don't know about it, and they don't detect it, and they don't cure it. And after 15, 20 years, being a latent disease, it presents as hepatocellular carcinoma. So what do you have to say about this particular type of carcinoma? How dangerous is it? Is it treatable, not treatable? And how important is the testing and timely treatment of hepatitis C to prevent this cancer?
Yes, so unfortunately hepatitis C is very, very common. Hepatitis B and C both are very common in our country, and that's because of, people go to dentists or, untrained people.
Yeah, they're not sterilized and nothing. Barbers, dentists, parlors.
Exactly. Yeah. So that's a major epidemic that came in our country many years back. Now it's been more and more controlled, but still prevalent in our smaller cities as well. And hepatitis C, when it's not being properly treated for 10 years or something, it develops into hepatocellular carcinoma.
Right.
And once it develops into hepatocellular carcinoma, it is very, very lethal. Cure rates are low. People need liver transplants as well. So those are very, very expensive treatments as well. Sometimes even that does not, work properly, and then the cancer comes back. So for those aspects, I would really request people who have detected that, or who have, they may have suspicion that they have, had some work done, something like that, where they could not.
Yeah, there was exposure to such blood transfusions or needles.
Yes, they should get tested for hepatitis B and C regularly.
And once it happens, it's hard to treat, right?
So now hepatitis B and C are, there are new treatments have come
No, the
up.
cancer.
The cancer is very difficult to treat. But if we treat the hepatitis B and C, the cancer is unlikely to develop in those patients. So the best thing is to get treatment for hepatitis B and C, so it does not, progress into cancer.
What about hoarseness of voice or change in voice? Is that a symptom suggestive of any sort of cancer, and who should be looking out for it more, and what are the associated symptoms with a complete loss of voice over a long period of time?
Exactly. So that's the important aspect. If it's over long period of time. If it's shorter, we do see.
Yeah,
that
we
with
know
a
it's
lot of
just
people.
exertion. Yeah.
So throat cancer of the throat, which are mostly linked to smoking or miswar use, is kind of linked with head and neck cancer. So the throat cancers can cause your hoarseness of voice, and that is also is treatable, but you know it can be difficult because surgeries of the throat are very difficult, and for us to maintain that very important aspect of speech, we have to be very careful about what surgeries we can do, and if it goes beyond a stage, so it's difficult to preserve that.
So how do you
aspect.
test this? How do you know that the person has
Yes.
throat cancer?
So we go with what we call a laryngoscope. We put a small little camera.
So it's examination,
It's
basically.
examination, and we go and check that, and we do a little biopsy, and we see if that's linked to it as well.
Okay, what about persistent headaches and fainting, as well as vision loss, and sometimes a part is paralyzed and then they go and then they get detected on an MRI or CT and they come back with detection of brain tumor. So what would you say about that? How curable is that, and how is the treatment of brain tumor taken?
So brain tumors are varied. Some are very, very aggressive and difficult to treat, but some are very easily treatable. Some are kind of benign as well. So they can vary from a lot. So we have to do scans, MRIs to detect how it is looking. Sometimes we have to get a biopsy done. It's a bit difficult. So once the biopsy is done, we can then figure out how aggressive that is. And the aggressiveness kind of depends how we can treat it.
All right. So what other cancers do you, are you facing every day in your practice, which you think are more in the Pakistani population, especially lately, and they're actually bothering you, and you would want to tell everybody out there that, look out for these things, and if anybody around you has them, come over immediately to an oncologist, get a diagnosis, and then go for the treatment?
So a lot of times we see ovarian and uterine cancers in women. That is something that we do see because of women can present with bleeding postmenopausal.
Right.
They have bleeding, they get checked up. A lot of times the women kind of ignore that as well.
And we don't get pap smears
Pap
over here
smears.
regularly, so do you suggest that as well?
I think pap smear is something that has been effective throughout the world.
Okay.
In Pakistan, we don't have as much high rate of HPV prevalence, so we
Right.
don't touch, but we do see a lot of some cases as well. And we have WHO and other bodies in our country have started that pap smear campaign as well.
What about the cervical cancer vaccination that people have started for young girls, especially in the West? Do you think vaccinations help in preventing the incidence of cervical cancer?
Yes, that's been proven to help. That's one of the only vaccines that been proven to help avoid cancer. And it's not just prevalent in Western world where there's high promiscuity as well. It's also present in Pakistan, even with normal relations as well. It can be present. So you can think about it. How much do you want your daughters to be prevented from having cancer later on in life? So it's good to have them vaccinated early in the
So
early
you would
teens.
be suggesting this Gardasil as a good preventive measure?
I think that's a good preventive measure. All women should have it. It's not something very difficult to come out.
Okay, Dr. Saab, now we will be talking in detail about chemotherapy, but we'll be changing our place. Thank you. So Dr. Ali, we were talking about chemotherapy, and people are very, very scared as soon as they hear the word chemotherapy because of loss of hair, their skin burns, and then they're like, it's going to be very, very painful. How many sessions of chemotherapy are generally required? What are the side effects, and do people actually recover?
Exactly. So chemotherapy, generally we require 4 to 6 cycles of chemotherapy, depending on tumor type and how aggressive the disease is and how much control we want and what kind of setting are we looking at. If it's curative intent, we would probably stop at 4 to 6 cycles. If it's unfortunately like a metastatic disease is spread, then we would want to kind of go beyond 4 to 6 cycles, maybe longer, maybe a year or so, or maybe sometimes even longer. And now the things have changed. Things have changed dramatically in the past 10 to 15 years. Traditionally, chemotherapy was used, which was very toxic. People used to have a lot of hair loss. They used to have a lot of nausea, vomiting, diarrhea as well. People used to feel very kind of very down, very difficult, and they would have a terrible time. And you know, that was the kind of scary part about cancer. When people would mention cancer, the scariest part that would come up
was chemotherapy.
Yes. And the hair loss. They would seem somebody who's
and then
terrible.
The skin getting charred completely.
Exactly. So, but now things have changed. Things have changed. Now we're talking about targeted drugs. You know, those are targeted drugs which are, as per patient, we take those tumor cells, we test them under a lab, we do genetic testing, and then we come up with targets. So those targeted drugs are kind of patient exact, like, you know,
centric,
patient centric. So somebody who would have cancer, same cancer, 2 different people would have 2 different treatments for that.
They're tailor-made.
Tailor-made,
okay.
exactly.
So these customized kind of treatments actually make sure that the patient does not suffer all the other symptoms, right?
Exactly.
So, but why is it that people do not want to take chemotherapy? They don't want to go for these medicines and these injections, and they fear it, and they'd rather take their patient home. What would you suggest to them?
So this is something obviously very tricky. We have to when you talk to patients, they have these valid fears that when they go through this, they'll have a very horrible time, and even whatever time they have left, if left is stage 4, they would rather not go through it. But we kind of have to discuss with them. That comes case to case. If it's kind of benefiting a lot and it's not very toxic, then we convince them that it's going to benefit you a lot. You're going to go with your pain or whatever suffering that you're going through, that's going to alleviate, that's going to go away.
So initially, does it take time to adjust to the chemotherapy, and then eventually they get used to it?
Exactly. So it takes a bit of time. It takes a few weeks or maybe a month or 2 before patients get their tumor burden gets down and their effect of treatment gets up. So the initial month or 2 is difficult. And once they can get past that, they start feeling better. They start eating more, they start walking more, and then they feel that difference that they've gone through the treatment, and now it's benefiting them. And also the newer treatments, they have less of those kind of side effects. So we can explain to them that, you know, this is a new treatment that's come up. It's not traditional like previous chemotherapy. It's not going to cause any hair loss. It's not going to cause, you know, problems like vomiting as well.
Okay.
So you're going to tolerate much better. So we kind of can convince them about it as well.
And do you combine it with radiation as well? And
Yeah.
what kinds of radiations are they, and how often are they exposed to it, and do they have side effects?
So radiation is also a part of our treatment as well.
Okay.
Some cancers need more radiation, some cancers need less radiation.
Okay.
So like head and neck cancer, we're talking about throat cancer as well. So those are more about radiation-based treatments as well. For breast cancer, some bit of radiation is needed, not all of it, you know. For colon cancer as well as uterine, we don't need a lot of radiation there. We can treat it with just medicines as well. So those are, radiation itself is toxic as well. It has its side effects.
Okay.
It can cause a lot of skin burning as well,
Right.
some pain as well. Overall, it's tolerated well. We have new treatments as well. They are now kind of targeted radiations where they have multiple beams come in, and they only, the tumor, they focus on those.
Okay,
So
it
if they're
burns
coming from
only the
different
tumor.
sides, it can focus on the part here and not cause damage to overall body as well.
So do
they're
you
not-
accompany it along with surgery? I mean, is surgery alone enough, or do you have to go through chemotherapy and radiation and surgery together?
So nowadays we kind of trying to stay away from chemotherapy as well. There is a
Okay.
concept now where we want to, if the chemotherapy is not needed, we try to stay away from it. A typical example would be something like a breast cancer, older people who's hormone positive breast cancer. We talk about if they go through surgery and the tumor is kind of small enough, then we do some genetic tests. How likely is it going to come back? So is chemotherapy going to benefit or not? So there's a group of patients who will not benefit from chemotherapy, and we avoid that. So, certainly is the case with some other cancers as well, in colon cancer as well. We do some genetic tests as well, and we see how responsive is it going to be for chemotherapy.
So what is this machine for that we see here? What does this machine do?
So this is a chemotherapy mixing area. It makes
Okay.
sure that when the chemotherapy is being mixed, there are a lot of toxic fumes in it as well. So it makes sure it kind of decontaminates that, and it has HEPA filters in it, and it makes sure that the air that's coming out of it is clean, and it goes kind of away from the place that we're kind of working in as well. So it sterilizes the air, making sure that it not goes away and nobody who's making it or people around it is not harmed from it.
So what would be your message out there, just as we're about to leave, what is your message out to everybody out there who's watching our show regarding cancer, its treatment options, and how early should we detect it and not fear it?
So the important message I would want to say to everyone is that we should be leading very healthy lives. We should stay away from smoking, stay away from stress as much as we can. I know it's difficult, but we try to stay away from it. We try to have regular walks, stay healthy. You know, if patients have or anybody has any symptoms which are linked to cancer, like we said, any lumps or bumps or weight loss or anything like that, go to a doctor early. Go and ask your GP or whatever doctor that you see, and go and talk to them about it. Is that lump, can it be cancerous as well? Can it get tested for it? For women, I would highly request that don't be shy. Talk to anybody you know, any lady in your house as well. Just tell them that you have this lump or have this thing, there's bleeding that's there. I need to get it checked out, and ask their help and get it checked out. The earlier we detect, the better outcomes we have. The more likely we're going to have saved lives. The more likely we're going to have less toxic treatment, and you're going to be living longer for it. And you can think about it. If you're not even just doing it for yourself, you should be doing it for your family as well.
Thank you.
And so, one last very important aspect I would want to is that cancer itself is very, very kind of depressing. It's a very big, challenging mentally. So whenever we see people around us who are going through cancer treatment, or facing through it, we should be supporting them. We should be not telling them, oh, you've had cancer or something like that. We should be supporting them, telling them you'll be fine, go through it, encourage them, financially help them, emotionally help them, physically help them, and make sure they go through this tough journey, very, very easily. I think that's a very important aspect.
Thank you so much, Dr. Ali, for being with us today. Thank you so much. And we had Dr. Ali Wajid, oncologist, with us, and you heard it from himself that keep your eyes open, keep looking for symptoms in yourself and in those around you so that you can detect them early in time, because early detection saves lives. Thank you so much for watching, and we'll meet next time, inshallah.
Thank you so much.